I'm Jodie Copley. I'm a senior lecturer at the University of Queensland. I also have the role of Clinical Education Program Director, and I'm a clinical educator myself. I have students on placement in our university clinics. One of the really important things, I think, for an educator is thinking about how we help students with learning clinical reasoning and learning how to guide their practice using OT theories and models. Really, I think that's a critical part of what we can impart to them, or what we can, foster in them, because that's the essence of a professional. I mean, a student can come on placement and have a bunch of process style objectives that they tick off from week to week, but doing the tasks is not the same as understanding why they're doing those tasks, what they're doing with clients and patients and service users, and how they're making those decisions, because that's the essence of their professionalism and really what makes them an OT. So thinking about how we teach that, I think, is a critical part of clinical education. I find that really designing things so that students articulate their reasoning makes my job easier. Having systems or processes that lead them to need to tell me why they've chosen to do what they're doing is the critical part of it. Of course, what's also important for clinical educators, and I've certainly experienced this myself and with a lot of other clinical educators I've worked with, is that you as an educator need to have clarity in your own mind about what models you're applying, what frames of reference or practice approaches or intervention approaches you're using, because I think that often the more experience you get anyway, that becomes really implicit and you don't think about it, and it's harder to articulate. So I've found that when I've been, mentoring other clinical educators, that's something that we spend a lot of time on, is being really explicit about what's in your head, about how you're thinking and why you're thinking it. And students learn so much from you talking through your reasoning, even if there are parts of that that are a little bit unclear or a little bit unsure. That's real world, that's real life. We don't know, it's not a linear process. When we're working with clients, there's so many things we need to take into account in terms of context and individual issues and environment, and all of those systems around the client. And to some extent, it's great for the student to be exposed to that, to expose to your thinking. I think how I manage that so that I don't overwhelm the student, because students are novices. So because they're novices, they benefit from some kind of rules, which is difficult for therapists because, we do use rules or sometimes protocols and processes, but we know that the process of clinical reasoning is much more complex than that. I find clinical reasoning tools to be useful for students. So a lot of organisations will use planning forms, assessment planning forms, intervention planning forms, and so forth. In my practice, I've tried to supplement that by using extra process type forms for students. So we'll use a mud map form, we call it, for them to take their assessment information on a client and really sort of organise that in a way that then leads them to what they're going to do next, and to be able to justify why they're going to do that next. So students will use those kinds of tools as a way of preparing themselves and thinking through the process they're going through, and then be able to present that or talk that through with us as clinical educators. And I think it's important to be very clear with the student that it's not a presentation as in you need to have all the answers sewn up, but it helps them raise questions so that it's a point of discussion. It's a forum for discussion. I got to this bit and then I thought, well, I know there are these issues there, but then where would we go with that in intervention? And so it's just a way of structuring that systematic process of talking through your clinical reasoning and bringing in all of the different facets without it being too overwhelming to the student. And obviously it's something you scaffold. So to begin with, you'd be filling in parts of the story or parts of the reasoning for them, and then raising questions to them. How do you think you might do that? So this is what you found out here. What does that make you think in terms of the next step? So often that process is really tied in with lots of questions. I ask lots of why questions. Why do you think that is? And the questioning process itself, I think, is something that you can hone as a clinical educator. You can do it with your clinical reasoning tools, so it's written down and there's something for you both to focus on and talk about together. But you can also hone your skills in leading the student to the answer, so that, just like we do with our clients sometimes, is really facilitates success. So if I say to a student, why do you think that's the case? I'm always very aware of my non-verbals at the time, so I don't say, why do you think so, but why do you think so? And if that's difficult and they're not sure, then, you know, I'll go to the next step and say, do you think it might be for this reason, or might it be something to do with this? And I'll give them clues, I suppose, or give them options, so that eventually they can say, oh, I think it's that. And then, you know, they feel like they've actually nailed something. And that's really important to keep their confidence, you know, boosted through that process of learning something that's tricky. And clinical reasoning it should be tricky in some ways for students. If it's too easy, if it's too straightforward, then they're probably not doing much reasoning. They're probably just copying what they're seeing you doing rather than thinking it through themselves. So I think being comfortable with the fact that you don't just master clinical reasoning like that. I often say that to students. You know, if you're getting it like this after the first time you do it, then, you know, that's something that's easier for you to learn. But let's grapple with some of the harder things and use some of those tools and processes to work through it in a scaffolded way.